Hi, my name is Katie Herring. I'm a student at Walden University, and this is my health assessment video. And to take into the environment, this is where I'm filming it at. And right there is my volunteer. And this is the rest of the area. And we're going to begin. Hi, my name is Katie Herring. I am a nurse practitioner student. I'm going to obtain a health history from you. But before I begin, do you have any impairments that may impede this interview, such as blindness or deafness?
No.
All right, let's begin. So tell me your name and date of birth.
James Herring, August 10th, 1990.
Okay, and how old are you?
28 years old.
All right, and have you had any recent issues?
I've had pain akin to a kidney stone passing this past Thursday at September 13th.
Okay, and do those happen often?
Those happen 2 to 3 times a year.
How do you deal with it?
I deal with it by hydrating thoroughly until the kidney stone passes, and for any pain management, I've taken painkillers that vary in strength from a Tylenol to, in very extreme cases, a prescription of Lortab.
Okay, all right. As far as a past health history, have you had any surgeries before?
I had an appendectomy back in 2001.
Okay, any reoccurring illnesses or anything?
No.
About how many hospitalizations you've had?
I've had one other hospitalization that was as an outpatient for getting treated for the first experience I had of a kidney stone passing back in 2011.
Okay, and have you been diagnosed with any medical problems or any psychological problems or any health problems?
I was diagnosed with generalized anxiety disorder back in 2015, and that is treated with 5 milligrams of Lexapro twice a day, and for any anxiety attacks, that is treated with, as needed, half milligram dose of Klonopin.
And is there any other medications you're on?
No.
All right. As far as a personal history, or social history, what do you do?
I work as a computer engineer at Georgia Tech Research Institute.
All right. And are you married or have any children?
No.
Okay. And as far as social activity, what do you do on a weekly basis for social activity?
I participate in a trivia contest with a group of friends.
Okay. And as far as physical activity, what do you do on a weekly basis?
No physical recreation or any physical activity outside of what is required at my job.
All right. And do you drink or smoke or anything?
No.
Or participate in any substances or any drug-related things?
No substance abuse.
Okay. All right. As far as a past health history for your parents, do they have any past health history to be aware of?
My mom suffers from heart disease as well as lung disease due to her lungs being injured from incurring damage from numerous blood clots. She also suffers from depression and anxiety. My dad's health history involves heart disease as well as heart murmurs, and he also has had multiple back surgeries and suffers from scoliosis. And he's also undergone a liver transplant.
Okay. As far as your grandparents, does your dad's grandparents have any health history?
Yes. So both my dad's grandparents died of heart disease, and they've also have a known family history of breast cancer and prostate cancer.
And do you happen to know the ages they were diagnosed with breast or prostate cancer?
No.
Okay. As far as your your mom's side, your grandparents on your mom's side, do they have any health history?
My maternal grandparents are still living, but they have had a history of heart disease as well as stroke, and there has been a known family history on the mom's side of the family of psychological issues like Alzheimer's and dementia.
Okay. And do you have any siblings?
Yes, I have 2 sisters and 1 brother.
And do they have any health history to be aware of?
My brother has Down syndrome and suffers from a severe case of mental retardation. He has had open heart surgery. My older sister suffers from depression and anxiety and is also overweight. My younger sister has no major medical issues to note at this time.
And one other question: do you remember what you've eaten in the past 24 hours as your diet?
My diet in the past 24 hours consists of a meal or replacement beverage, as well as a bowl of cereal, a sub sandwich, a bag of chips, and for beverages I've drank Coke, Gatorade, and water.
And about how much Coke, Gatorade, and water have you had?
About 3 cans worth of Coke, which is 36 fluid ounces, and about 12 to 14 fluid ounces of Gatorade, and about the same amount for water.
Okay. All right. I'm going to briefly cover all the systems to make a comprehensive health system check. So as far as general, do you have any problems with chills, fever, or any just fatigue?
No.
Okay. As far as skin, hair, and nails, do you have any problems with, such as your hair? Do you have any hair loss or anything?
No.
As far as skin, any rashes, itching, or unusual moles or skin conditions?
I have a number of moles on my body, a few of which have been removed.
Okay. And as far as nails, do you have any problems with your nails?
I suffer from a nail biting problem.
All right. Okay, so for your head and your neck, do you have any headaches or loss of consciousness or dizziness?
No.
Okay. And as neurologically speaking, do you have, as far as your head part for neuro, do you have any problems with loss of coordination or any weakness or anything like that?
No.
As far as mental issues, do you have any problems with concentration, sleeping, or eating, or any suicidal thoughts?
I suffer from generalized anxiety disorder, which affects me in the areas of concentration and sleep.
Okay. As far as your eyes, do you have any problems with your vision?
I have a slight nearsightedness, which is treated with corrective lenses.
Okay. As far as your ears, do you have any problems with vertigo, tinnitus, or any hearing loss or anything?
No.
As far as your nose, do you have any problems with nasal drainage, drippage, nosebleeds or congestion or anything like that?
No.
Okay. As far as your mouth and your throat, do you have any problems with your teeth or any ulcers or anything to be aware of?
I suffer from strep throat and/or throat ulcers about once every 1 to 2 years, and for my teeth, I have cavities every so often that are treated with dental fillings.
Okay. And as far as your chest and lung area, do you have any problems with coughing, shortness of breath, or you actually cough up anything?
No.
Okay, and no problems with chest tightness?
No.
All right. And then as far as your heart, cardiovascular-wise, do you have any chest pain, palpitations, or exercise intolerance?
No.
All right. As far as endocrine, do you have any heat or cold intolerances?
No.
What about any weight gain or weight loss problems?
No.
And any blood sugar issues or anything like that?
No.
Okay. And then for stomach-wise, gastrointestinal, do you have any problems with heartburn, indigestion, vomiting, or anything like that?
No.
And do you have regular bowel movements?
Yes.
Okay. As far as urinary, do you have any problems with flank pain, like side pain, or do you have any problems with blood in your urine, or frequency, or nocturia, or anything like that?
I've had kidney stones from two to 3 times a year, and I also suffer from nocturnia.
Okay. As far as musculoskeletal-wise, do you have any joint pain, joint stiffness, range of motion, or anything like that?
No.
All right. And then do you remember when you had the first signs of puberty?
I was 14 years old.
Okay. Any testicular problems or erectile dysfunction or anything like that?
No.
All right. There's only one other question I mean to ask you about health screenings. Now, do you participate in any health screenings?
I have a health screening every 4 to 6 months as a general checkup, and my mental health, I have a psychiatrist that I visit once every 3 months as to determine a general indicator of my mental state and make sure that my treatment is going as planned.
Okay. And what about dental?
I have 2 cavity inspections a year.
Okay. All right, well, I have got all my information that I need right now. If I have any further questions, I'll ask you, and I appreciate all your time. Thank you for your patience and consideration.
All right, thank you.
All right, bye.
And done.